protection of society and all the things that we care about. This is economic. This is an economic policy matter. This is a defense policy matter. We should be investing in this all the time, every year to get better. And we're behind the 8 ball here. And we have to begin to move forward. I congratulate all that are involved in this. I call upon the government to play its role. And in my mind, the government's role is not to operate this system. It's to enable this system. The government doesn't need to operate it. That's the source of people's concern. But the government has to enable it and organize it or participate in its organization. So, Brian, I broke into song over one question, but I have things I wanted to say.
That's outstanding, Governor. Thank you for that, and thank you for your leadership on this. This has been outstanding. I'll turn to Rebecca shortly, and Governor, we may come back to you here towards the end. But Rebecca, before the pandemic, not many people had heard of this jurisdictional immunization information system. I know I had not heard this, or an IIS. But what can you tell us about what an immunization registry is and what function they perform? And then what's ERA's role in the immunization community, both nationally and internationally? And then we'd love to get your perspective on smart health cards and where you see this going in the future, how this could help everybody in terms of understanding their vaccination status for a number of different use cases.
Well, thank you, Ryan.
It's definitely
good morning, good afternoon, good evening to everyone. I'm pleased to be with you this morning, and I want to first take your first question about immunization registries and what they are. So you are not alone. There are many, I think, Americans out there that didn't know that we actually had immunization registries in place. We have immunization registries in place in all of our states, many of the large cities like Washington, New York City, Philadelphia, some of our counties, and then also all of the U.S. territories and freely associated states are operating one in the U.S. So what is it? An immunization registry is just that. It is a registry of vaccines that an individual has had. It is consolidated into one record. So regardless of where somebody received a vaccine, maybe they received a vaccine in a mass vaccination clinic, perhaps they received one at a pharmacy, and there's a need for their physician to be able to see what record that person has. The immunization registry can deliver all of that information to the provider that's administering vaccines or caring for that individual seamlessly through interoperable mechanisms at the point of care. So I appreciate all of the work that has been done to get to this point. This has sort of been operating in the background for many years, but I think we're really seeing the true utility of it now as so many Americans are being vaccinated and need access to their immunization records.
Access. Can't just call your doctor.
Rebecca,
okay.
Let me just
drill
down on that for a second. One of the challenges that public health has had in the U.S. for quite some time is just the ability to have continuous funding over some of the things related to infrastructure items such as IISs as well. Give us a
Is that the problem we have?
How that hopefully is changing or evolving over time, or where you see this really needing to be emphasized going forward from the perspective of public health infrastructure, and to Governor Levitt's point, this idea of an interoperable ecosystem that allows for you to have access to that vaccination information.
Well, I really appreciate Governor Levitt's perspective on this. As somebody who's worked on the state side and at a nonprofit side, I think across the board, we see sort of the boom and bust of funding and how that is sent out to public health in volumes that you almost can't manage. And then as soon as we get through the crisis du jour, the funding goes away. And so it's really difficult to build systems that are sustainable with funding that comes in drips and drops, and then suddenly there's a lot and there's just no way to actually, I think, utilize that and invest it wisely. So I think there's absolutely a need for consistent funding to support an infrastructure so that when the next crisis hits, that we are all far more prepared than we are today.
Governor Levitt, you talked pretty extensively on this idea of a public-private partnership. You've led on this both in terms of your work in public office, but also in your work in the private sector.
Here we go. Fascism, baby.
Help us understand what that starts to look like in terms of, you'd mentioned standard setting and this idea of gaining consensus, but give us a sense as to what that starts to look like in terms of how we most effectively work together as a public-private partnership to make this happen.
Please, Rebecca, tell me. Please.
Collaboration is hard work. It
Oh.
starts with good convening, and that's
Who's this guy?
that has occurred. And the fact that the Common Project and others have come together, very important response to a need, and it has to involve common pain. And there's a lot of common pain right now. There's a lot of people who need who have needs that aren't being met, and so
That's Mike Levitt.
Together to collaborate. You talk about the public and private part of this. You don't need to go any further than just talking about the ISF, the state systems. They respond to different standards, and if the Congress wants to take a lead and say there will be a standard and this is the process, that something needs to happen to make that a common set of operating systems so that the states can then be part of a federalist system that we're part of, that we have a federalist form of government where the states do have independence, but there needs to be a means of being able to bring those together. That's the kind of thing that the government needs to do. Only the government can do that.
That doesn't make sense.
It's not possible.
States don't want your smart health cards.
What I call the last vendor standing strategy, which is everybody competing to become the standard. Completely convinced that they have the best and only solution. Well, that's not true. It's not true in this situation or in electronic medical records or about anything else. And this is an ongoing, long issue. But once the government has begun to enable that to come together in a collaborative way, just as Robert explained earlier, then we can begin to empower a marketplace who can take that information and figure out how the best way to deliver it to consumers, to compete, to find the best ways to access in a convenient way. Then you harness with the public side the best virtues of that system and the private side with the best virtues of a system that works to take that information and to deliver it in the most effective way.
What?
And it blends. That's the
I have no idea what he just said.
Public partnership, and it could play out here and is, but it needs to be accelerated.
Accelerated?
It's really helpful.
Are we helping the states out or not
One
here?
other
Like,
comment on
what?
that, Governor, is that,
Mike Levitt's the
obviously
former
there's
governor of
kind a
Utah
high degree of
and
sensitivity
former
about this
director of
concept
Health and Human
a
Services.
Vaccine passport versus a credential versus proof of vaccination. We have always talked about the work that we do together in the Karen Alliance about getting individuals more access to their own health information. Really, that's what this is about in terms of digital access. But give us a sense as to where you see this going in terms of what that means for an individual to access their own information and how that potentially could help us reopen the economy.
Well, there's always a question about who owns the data and the rights to access that data. But one thing is unchallengeable.
Private public.
I own a right to have my own data and to have it in a form that I can present it conveniently for the kinds of things I want to do. And that's fundamental to this process.
You can do whatever the fuck you want.
Access my
You don't
data
need your
in a way
data
that is
to do
credible,
things. This is ridiculous. This is
so
like
I can present it
ridiculous. The whole
in a
premise of
way
this
that
is
I
ridiculous.
Now, this is not the government requiring people to do anything. It's the government enabling people to get information they own in a way that's convenient to them. It's the healthcare system providing that access. Now, we've broken new ground.
Oh my God, call your doctor. Get a printout. Like, this is not that serious. Email me, bro. Like, this is ridiculous.
That they can do with it what they need, and it's making them healthier, and it's making our system better.
No one's getting healthier in America.
Same thing here.
No
We
one.
just have to be able
More
to give
vaccines,
people
more
access to
medication,
information they
shittier
own,
hospitals, hospitals closing, understaffed hospitals,
in a fashion that
massive medical debt. No one is getting healthier in America. This is a bunch of bullshit. Absolute bullshit.
Yeah, that's really helpful. Thank you.
That's so helpful, you asshole, you piece of shit.
One of the questions
So helpful.
I think that we got in here, Rebecca,
Dumbass.
is really for you, is this idea that, from a state IIS perspective, how does it really work today? In other words, can you talk about how it works in terms of states
Convenient.
actually sharing immunization information with each other. So more of
Yeah,
a
so
business
convenient
concept. And then talk
to be
about
put in
some of
digital
the
prison.
newness
So
associated
convenient.
with, state IIS is actually providing consumer access, and give us a sense of where that is.
Sure. If I may, I would like to just open this up by saying, the immunization information system community's underlying principle has always been collaboration. And I think that's truly where why we've been able to get to where we are today. So we have standards across our community that have been in place for almost 20 years.
So why are you changing
even
them?
Longer in some areres. But I think what we often find are you can create a standard, but until you're actually measuring and ensuring that everybody is adopting those standards, you can have a standard, but nobody's there to check on that. But I think collectively, all of our states have worked really hard to really pull together and adopt the standards. And so I think all of that is why we've been able to share data with providers and providers with IIS. So as far as how that operates in the real tangible world, if you, Ryan, are going in to get a vaccination today, your provider will hopefully query the immunization registry from their electronic health record system. They will then get your vaccination history for you.
Yep.
They will also look to see if there's a forecast of what you may need, what immunizations are due. And then they will make the appropriate decisions based upon the discussion with you. They'll administer vaccines if needed. And then where that vaccine goes is into the electronic health record system. And then the electronic health record system transmits that electronically back to the immunization information system. The IIS then reconciles all of that and returns a new complete record and a new complete forecast for you as well.
Okay.
So this has been happening for many, many years in the background.
Yep.
You just often don't see it anymore because everyone has electronic health record systems and they just print it off and they don't know where the data is actually coming from.
Yep.
Behind all of this is that IIS. I think the other piece is that state to state. And so the other compounding issue is standards are fabulous. They're wonderful. But the other component is policy. And when you have a policy that says you can either do something explicitly or you can't do something explicitly, you have to modify.
They're really setting us up for just
and your standards to meet those
crazy
policies.
amounts of vaccinations for nothing. We don't have disease spreading in America. COVID was a biological weapon, clearly. And now they're using it to roll these passports out. This is ridiculous.
At the state level, but we're moving in that direction.
Disease doesn't just spread through a place with sanitation.
I would say it's because of the policy concerns.
This is ridiculous.
Direct-to-consumer access can avoid some of those legal challenges, right, that we have.
Yes, absolutely. And
yes,
you had asked that question as well.
Yes,
so absolutely. Allowing folks to have access. Quite frankly, it's on a state
buzzword access. Yep. Access. How could you get your medical records without this app that we have the back door to? I mean, how could you have access? How can you gain access to the world without access to your medical records? Like, this is ridiculous, this premise.
A quick question, because it's obvious that the states are working very hard to implement this and to create standards that are meaningful because of the availability.
Meaningful.
Is there anything
meaningful standards
Congress could do that would make that easier, or are there things?
She laughs because can we throw everyone on a universal digital identity in an easier way?
Gaps in terms of the policy side.
How can we make this easier? How can we just force people to do this?
For how IIS should operate, how each state should operate. I think there's a need for all providers to report. This is the first time COVID is the very first vaccine where all providers are required to
tell the
report
technocrats
to
that I didn't start this at 7 a.m.
What that does is that helps give us a great set of data.
They did.
It also makes sure that we have a record for an individual when they need it. Outside of COVID, it's sort of if a provider is obligated or have requirements, but it's kind of a mishmash of policies out there for who's to report. So
mishmash.
We collectively need
confusing.
A lot of assistance at the
Let's streamline. Let's bring it all together under one smart health card from the Vaccination Credential Initiative.
Think of our system of government as a group of PCs.
PCs, yes.
They need a common operating system.
Oh, yes.
And it's going to be difficult.
Interoperability. Let's use buzzwords. Come together. It's called centralization. It's called consolidating power. It's called public private partnerships. It's called fascism, but we're not going to use those words.
In order to work like a network, you've got to have an operating system, and I think it's very difficult.
Exactly, Tyson. They act like states have their own, sovereignty. They have their own, ability to make decisions. But when it comes to this, no, we need to connect everyone. We need access. We need everyone to have access to their medical records so they can have access to the world, and we can do things for the public good.
That network. We just need some help at this point.
Oh my God, we just need help to get everyone on a universal digital identity.
Rebecca Boyle, Governor Mike Leavitt, thank you both so much for joining us today. We apologize for Andy Slavitt and Vicky Tripathi not being on the call. I think there's still some technical difficulties we're working out. But if they're able to join us later in the session between now and noon, we will definitely put them on as panelists. But thank you, Governor Leavitt. Thank you, Rebecca, as well. I want to turn it over to my colleague, Brian Anderson, for the next panel.
I didn't even hear the Asian guy. I must have missed him. Now I have to go find the next panel because they're doing this a weird way.
Recording stopped.
Okay. Well, that was weird, guys. I have to go find the next panel. This is just so weird. It says start soon. Okay, so the next panel is going to be, this is a good one, guys. Josh Mandel from Microsoft. He's an MD from Microsoft. He's the chief architect for healthcare. We have a woman from the MITRE Corporation, which is a defense contractor. We have the Commons Project Foundation, who's a startup that was literally made for vaccine passports before COVID. We have Apple, and we have someone else from the MITRE Corporation. Let's join in. Let me see if I can get this pulled up real quick. This is so bizarre.
Recording in progress.
Trust registry or trust framework is all about.
They already started.
Excited to
They just
have Dr. Josh Mandel,
opened this.
Dr. J.P. Pollock, Dr. Ricky Bloomfield, and Dr. Nalini
hi.
Panini. I'll ask each of our panelists to introduce themselves as we go through the questions. And let's go ahead and get right to it. The first question, Dr. Mandel. So Microsoft and you in particular have been working a lot in the space of health cards and smart technology.
This is so
and
weird.
I'm aware that your work in particular on smart health cards really started before the pandemic even began. Tell us a little bit about the genesis story of smart health cards and how you contributed to its development.
Yes, please.
Sure. So I'm a physician and a software engineer, and really I see
what a combination. Aren't you lucky?
Today on health cards, and the work that motivated me back when I was still a medical student to go into the medical informatics field. And that was really all about making sure that the right people could get access to the right data at the right time. And as a medical student, I was very interested in making sure that clinical data could surface inside of the right workflows. And then as a patient and healthcare consumer, I became very interested in this question of...
He's like, when I was in school, I got really interested in medical tyranny. So I combined computers and health. And then I got hired by Bill Gates. You weirdo.
Working on this from the research.
Oh, Harvard. Yeah, they're good guys.
It's really all about APIs. How do we think about defining the right data models and the right authorization structures to give individuals a way to share their own data or to share data that they had a right to see with the apps that they chose, so that they could feed those data into an app that might help them manage their records, or might help them
need an app for that. I mean, come on.
Or better understand their care. And that really led to my working very closely with the International Standards Committee, with HL7, on the Smart on Fire standards.
Yeah.
And those standards provide consumer access. They provide a way
consumer access. There's that word again, guys. Access.
Certified health record system.
Do they all believe that?
Part of the national push for consumer access, for patient access.
Are they all independently coming up with this word, access?
Anybody can use under our
That's kind of weird.
Certification program, and there's hundreds of different electronic health record vendors that tend to be the systems that manage.
Oh, but there's too many vendors, right? Too many vendors. We need to streamline.
So that's all been playing out since 2015, 2016. These APIs have started to become more and more widely available. And then starting maybe the year before the pandemic, so starting in 2019.
This guy definitely comes from a rich family.
Was asking the question, now that we've got access to these data, what's next? How do we make them more usable downstream? And one of the key challenges there was around identity and trust. So I can get a copy of my data and store it on my home device, but what if I want to share it downstream? What if I want to show it to others and make sure that they understand the chain of provenance?
Yeah, we didn't used to just share our medical history with others.
What are the new capabilities
Not normally. That was not the norm before.
And that's the work that
Shouldn't be the norm.
into the Smart Health Cards framework, bringing together a community to help answer those questions.
A community.
And provide technical
access.
So that not only
community.
can I see and access my records,
Access.
But I can
there it is
and
again.
share them downstream
It's like clockwork,
in a safe
guys.
way that's driven by
It's amazing.
interoperable standards. And along the
Interoperability.
way,
Interoperable. They use that in blockchain lingo too.
Not just with the health record vendors that have been kind of the bread and butter of my previous interoperability experience.
Interoperability. There it is. I'm like a genius. No, I'm not.
And public health
I just
and
watch.
innovation information systems. And it really has taken all of those participants to build out this kind of system.
Oh yes, thank you. Thank you for that Pangea of knowledge. Thank you so much, sir.
Next turn to
Fucking
Dr.
psychopath.
JP, so you're the chief architect of the Commons Project, and you really
The startup that wasn't meant to be a vaccine passport startup, but just happened to be right after it was made. Yeah.
Build a broader framework
Right after it was founded.
And verifiers, this concept of a trust framework. Share
Trust.
a little bit more
Trust.
about
Access.
how
Trust.
you've done that. What does it mean to be part of a trust framework between issuers and verifiers, and why is that important to what Smart Health Cards is all about?
Yeah, thanks, Brian. So, just tag a little bit of stuff on Josh's origin story there. So, we at the Commons Project have been working on empowering people with health information, right? And for all the reasons that Josh describes, the best way to go about doing that is to leverage open standards and the data access that we hope that all people are granted, wherever they might live or wherever they might receive care. We started this.
Show us your home,
Common
JP.
Health, which is a personal health records application, much like what Ricky will be talking about in Apple Health.
Oh, thank you.
Android platform. And during the pandemic, we were engaging in work in the East Africa community to help truck drivers and
we love helping the Africans.
Goods and services.
God, we love helping the Africans.
Throughout the East Africa community.
I mean, they're not our test group or anything. They're not our pilot group.
These test results were difficult to trust. So at the border, you would get a test, and you would be stuck at the border for sometimes 2 or 3 days waiting for your PCR test.
Oh my God.
So we worked on a
PCR test that doesn't tell you if you have a
involved
disease or
people
not.
getting tested
I mean,
at a particular
oh my
lab,
God.
And bringing their results with them digitally to the border so that they were able to cross. But it became clear that this was not going to be scalable, and that federating that model of trust globally was going to be much, much more challenging. Around this time, we were turned on to the work that Josh was doing. Because that work was leveraging a handful of existing open standards, it fit very well with the model that we were already using for consumer access to data. So we certainly jumped at that opportunity to collaborate. With Josh, who's done so much for data access and interoperability with Smart on Fire and the like, with Ricky and the Apple team, who really spearheaded so much of the direct patient access that we have from health systems today with their work on Apple Health.
Access.
That might have, thanks to the role that you've been playing in the development of the FHIR standards along the way. So, where this netted us out was beginning to understand how smart health cards work and the beauty of the open framework, meaning that anyone can create one. There's ample flexibility for lots of different kinds of organizations to develop these.
Oh, anyone can build one. You can build your own prison. You can build your own prison. How cool. How cool, guys.
Right? We need to think about
you can attach your own chains to your ankles.
Can be trusted to issue smart health cards.
That's awesome.
Which of those issuers can be trusted in different sorts of circumstances. So this is where a trust framework can help.
Trust access, interoperability.
Just a list of issuers along with associated metadata who we feel and the community feel are trustworthy. And ultimately, people can consume a trust framework in different ways.
He's the trust guy.
Make their own choices about which particular issues they may trust in different circumstances. And it's our role to convey, this is a particular set of issuers. Here's the information that we understand about these issuers, and here are the requirements to become one, and the processes that we follow to ensure that they meet those requirements.
Oh my God!
So we operate alongside the VCI community and steer code, the VCI directory. And also the
we're going to look at the VCI directory. Oh boy. It's fun. I'm the guy from the startup that works with the directory of fucking monsters.
Steer co members with pretty broad community input, I would say.
Tell us more.
And
Tell us more.
We have a particular set of issuers that we have decided to admit at this point to keep things limited, understandable,
Understandable.
And really, in a good place.
Yeah. I
For
thought it was
all
for
of us
everyone,
to
but
trust
no.
the list that we have.
We have our
So,
core group.
Because this is so new, right? This list includes things like pharmacies that are offering vaccinations and labs,
Rite-aid.
the labs that perform those tests, clinicians who are providing care, the insurers who are paying for those services,
United Health.
public health departments that keep the communities that we live in safe.
Yep.
So how does this work? The VCI directory is open and available to everyone. It's effectively a JSON file with some technical checks and things that go along with it. The Commons Project Foundation offers APIs and verification services around that directory for folks who are interested in that level of service. But if you're looking to verify smart health cards, there are several places that you can start and leverage these trust tools. Including
trust. I mean, if he says trust 10 times, it has to be secure and trustful, trustworthy, trusty. It's very trusty you are. Oh my God, this guy is
I know that when you're dealing
ridiculous.
with the currency of trust, it's important to
Trust.
be open and
Trust.
transparent about everything
Trust.
you're doing. And I know that you and the VCI team have been doing a great job.
Thank you so much, VCI,
all that process.
and all your horrible corporations that are attached.
Speaking of openness, so Nalima,
openness.
so MITRE's role,
MITRE,
has been
defense contractor who works with the Army.
Technology and the standards.
Yeah, let's go.
Share a little bit about your role, MITRE's role, in pull all this together with HL7, the standards body.
Yeah, openness. The military is all about openness. Let's go. Talk to me. She's not crazy.
Yeah, absolutely. Thank you, Brian.
Thank you. They're not doing operations on my brain.
Expertise
Here she goes. Crazy eyes.
And reference implementations to help prove, advance, and disseminate new technologies. That is aligned with our mission as a nonprofit that runs federally funded research and development centers.
All right. They picked her for the diversity card, I see. Awesome.
Expertise in the healthcare area in standards-based open source development and testing tools. So I think that's what our role has been within VCI. We have an open repository and GitHub under DVCI with some offerings under the Apache 2.0 license. One of those is a health cards Ruby library, which is kind of a multi-purpose reference implementation for both issuing health cards and verifying them. We've been working in conjunction with ERA, the American Immunization Registry Association, on an issuer reference implementation that they'll include as part of their interoperability toolbox, which will allow users to kind of kick the tires on generating smart health cards from their existing IIS data services. We're sort of pivoting more, now that more and more people are able to get their hands on their smart health cards, we are pivoting to supporting verifiers, including small businesses who might want to use these cards to safely serve their communities. So under that, we are planning to soon, fingers crossed, release a web-based verifier offering, which will exist, alongside the existing mobile offerings. And for those who are interested in
are they going to make you do vaccine passports to surf the internet? This is going to be great, guys.
In the form of a Jupyter notebook. And on a sort of related side note, I think you'll hear later in this forum about the great work California has been doing to open source their issuer application.
Oh, we know.
MITRE has been lending our open source experience to hopefully get that.
Pro tip, California and New York were pushing vaccination laws before COVID. Mandatory vaccination laws. Medical tyranny before COVID.
HL7 International to get our implementation guide sort of formally incorporated as part of their standards. HL7, for those not in healthcare, is probably, I think, the largest not-for-profit standards development organization in the healthcare space. And bringing our data model under their purview kind of injects a healthy degree of process and governance to maintain that data model long term. So we just went through
half the country's in medical debt, and this is the shit that they spend money on.
And we did achieve the threshold of positive votes to be able to, within the next couple of months, put out a formal release. Right now, we're going through the reconciliation to address any of the issues or concerns that came up during that ballot process. And all of those meetings are
democracy.
Open to the public. HL7 operates in a very transparent manner. And
so transparent.
Love to get community input on any of these
Yes, so transparent. We don't have secret meetings now.
Like feedback on some of the terminology and vocabulary questions from stakeholders and the international and cross-border use cases.
Oh, international. Let's bring it. Let's bring it beyond. Let's go to Africa. Yeah. Let's go to India.
And verifiers. I think that use case has kind of taken a backseat to vaccine verification a little bit, but it is an important
vaccine verification is not an important thing. This is crazy.
Like to provide
This is actually nuts. This is fucking bananas. These people are cuckoo or just evil. Like, what the fuck?
Feedback and suggestions for future enhancements there.
Oh my god.
That is my plea. I'll turn it back to you, Brian.
Oh my god, thank you so much.
It's great to hear you just describe how this whole community is coming together around empowering public
It's a
health,
community.
empowering states like those in
It's a
California,
community, guys.
New
We get
York.
paid to
I
make
know
digital
that
prisons.
many
It's a
of us are
community.
aware of the
Access,
announcement
interoperability, trust.
really about
What
how
the
do you
fuck?
take this kind of technology,
These
standards-based
community. There's no community, you dumb fuck.
certainly for this pandemic,
Oh my god.
but beyond. And what does that look like? And so with that in mind,
Come on, Ricky.
turn to Dr. Ricky Blumenfield.
Yeah,
So,
Ricky. Ricky.
At Apple, you developed this wonderful interface between smart health cards and one's digital wallet. I'd love if you could perhaps maybe walk us through
Universal digital identity connected to your money. The conspiracy theorists were right.
Where are smart health cards going? So we're starting.
Yeah, where are they going? Why are we doing this?
Empowering individuals and empowering public health.
Empowering people, access, but like what else?
Copies of their health data. Of course, right now it's with vaccination records.
Vaccination
Where's it going
records.
from here? But maybe a demo first.
Oh my god, this is going to be
Yeah,
crazy.
Happy to jump into that. I think a demo can often speak 1,000 words. First, I would be remiss if I didn't just thank the other panelists here and point out and reemphasize a point that I think Rebecca Coyle made in the last session as well, which is all of this only works through deep collaboration across the entire ecosystem. Those developing the standards, those implementing across platforms, as you heard on the Android side as well as the iOS side, or those who don't have any device at all. We need to make sure that these the technologies and capabilities are available to as many people as possible, because healthcare doesn't discriminate in terms of who can get sick, who needs to be vaccinated, and who needs access to their information. So we really need to make it as broad as possible. And at Apple, that's been core to our mission to make this, to build what we're doing on open standards, so that nothing here is proprietary to Apple, but also works across platforms, and to do it securely and privately. So I'll go ahead and share my screen.
Oh, he's got a little presentation. Here's a little picture in picture. Oh boy, guys.
So,
oh
this
boy.
is my phone running iOS 15.1. And as Brian mentioned, we added support for the ability to bring in smart health cards, no matter what the source is. We now have many states are supporting this, many provinces and territories in Canada and other countries around the world. And so I'll bring up one of these example QR codes. I'm not showing you any real patient data right now. And of course, this QR code could be scanned. It could be printed if you don't have a smartphone. And if you're accessing this on a smartphone, for example, in California's portal, you might see a button, for example, add to Apple Wallet and Health. In this case, I'll go ahead and tap that button. And when that happens, you can see that this is automatically recognized, and there's a preview of the information that you can see before you add this to your phone. Of course, you want to make sure you're adding the right information, and all of this throughout is in the user's control every step of the way.
No.
I'm going to tap Add to Wallet and Health, and that information has then been added to your wallet as well as to the Health app. And so when
your vaccination is in your wallet. Guys, this is not normal. This is not smart. This is not cool.
And when I tap on View in Wallet, you can see that this information is brought up right in the wallet in a simple and easy to access pass. This vaccination card.
This is weird.
Is also available on your lock screen. But one of the things that's so important to us is that the user maintains privacy throughout. And so when you want to bring this up on your lock screen, right now I'm actually covering up the Face ID of the phone so it can't authenticate. And you can actually see here that the information on the vaccination card is not visible unless you're actually logged into your phone. And so I'm going to uncover Face ID.
Access, trust, security, interoperability.
Right away.
Thank you, Apple.
And then the last piece here is we recognize that once users have this on their phone, they might want to share it with other apps that they trust. And again, that's something we wanted to put into their hands so that they control who has access to this information.
Throwing out your vaccination card to apps. What is happening?
Developers, where they can see how to implement this API.
I mean, once this is normalized, people are going to just share these vaccination cards like nothing and not know why they're doing it, but they're being forced to, so they do it anyways. This has to stop. This literally has to stop. This is crazy.
And then that record is shared. And again, all this is in their control. No data leaves the phone without their express permission. And so I'll go ahead and stop sharing my screen. And so the question was...
Yeah, but if they force you to use this to access things in life, you are going to share it. And they'll say, oh, you chose to do it.
Prior to smart health cards to let users access their health information, as JP mentioned. We started out in 2018 with 13 health systems and 3 EHR vendors. Great early partnerships there, and this was before a federal requirement to make available FHIR-based APIs. And that has since grown from the 13 and 3 to over 700 health systems and clinics across the country, representing over 12,000 locations, as well as 12, from the 3 went up to 12 EHR vendors, lab vendors, as well as custom implementations such as the VA, who of course have their own infrastructure there. And this all speaks to the power of not what Apple has done specifically, but we wouldn't have been able to do what we did without aligning on a common standard in the entire ecosystem. And that's the real power of what's available here. And so today, through the FHIR API, users can access not only their immunization records, but their labs, their vital signs, medications, procedures, conditions, etc. And so you could see a world in the future where this flexible smart health cards format could be used for other data types. So right now it's used for COVID immunizations and COVID test results. I could envision that it can be used for other vaccination types in the future.
Oh.
So parents could get access to their children's information.
Parents.
Easily share it with,
just parents and their kids, right?
As they have been required to do for decades now.
Because we've had vaccines, so we need...
That can be made available. That's one of the reasons.
So this is great.
Common,
Jesus Christ.
Standards really makes this work, because the FHIR data model is flexible enough to support any data type, not just immunizations or test results. And so it'll be exciting to see what the broader ecosystem does and how they come together to make this possible in the future.
It's great, Ricky. And so,
Ricky.
Given
it's great
this runway,
because we've had vaccines, so it doesn't it shouldn't matter. You should just do this. It's not a good excuse.
The deep kind of collaboration that is required.
It's in your wallet, with your money.
Thoughtful consideration on what some of those next steps are. How do we build consensus?
How do we build consensus?
I'm going to open this question up to the group.
How do we manufacture consent is basically what he's saying.
The rapid adoption that we're seeing, it's essentially becoming the de facto standard here in the United States and growing internationally.
De facto standard. We have people protesting in the streets all over the world. De facto standard. They're just going to keep going.
I'm curious, just to the group, who or what are the policy or technical things that are still in the way that we really need to address or come to consensus around to take this, in that direction that we just started to take.
Especially deep or challenging. I mean, they're very important to get right, and they're highly of testing and review, and sometimes even small changes can have an impact that's hard to anticipate. So it's very important to have that community together around decision making.
Community.
The technical details themselves are not that challenging, and I think we've seen many different systems pop up around the world that solve a similar set of problems with sort of similar or in some ways equivalent technologies, slightly different design choices. But the hardest challenge here is really getting alignment around adoption. And here,
adoption
Smart Health has maybe the strongest story because not only do we have a specification that's based on these open cryptography standards and open standards for signing data, but we also leverage FHIR. We leverage a set of healthcare data APIs under the hood so that the framework we've built can support not only the pressing health data needs of the pandemic with COVID vaccine results and COVID PCR tests that can grow to expand to support other use cases within the clinical domain. We've thought about these standards as supporting access to any vaccine record for sending a kid back to school, or for traveling in worlds where there's in regions where there's endemic disease where vaccines are required. So I think that's really the strong point. And
so all these QR codes that people have for their PCR tests or their rapid tests, this is just social conditioning. Oh, well, you already have been scanning these QR codes from these different, companies that handle PCR tests. So now they're just, they're going to take it to the next level. They're going to be like, well, you've already been doing that. You might as well just get this smart health card, put it in your Apple Wallet, connect it to your bank account. This is getting crazy. We need adoption.
And we will obviously grow to be able to hopefully accept testing results as well. But there are a bunch more in there that we want to be sure that we answer.
What else can we put in there, guys?
On that. I know that we're at time.
Pap smears.
And so what I'd like to do is, all of those of you that are joining, there is the next
colon examinations. What else can we put in your passport?
The next panel to join that group. And we thank you for joining, and we'll see you guys later.
Yeah, we'll see you, you fucking sociopaths. All right, I'm going to jump into session number 3 of 4 because they have an army of people behind this project. It's really crazy. Where is this? All right. Oh, they're still going. They don't know that they're still on. All right, so the next one is going to be the state of California, because they've been all about medical tyranny.
I think we're still on. So just again, encourage things. Everyone, I believe there is another panel.
Oh my God, they're still talking.
Right now.
Shut up. We have Epic Systems. We have CVS, the pharmacy. We have Levitt Partners again.
150 participants hoping for a good hot mic.
We have Cerner. We have the state of New York. Rajiv Rao. Oh boy, that's going to be a good one. And we also have Public Health Agency of Canada, because we have to go international with this. Oh my goodness. Here we go. Let me pop into this session. But they start so fast.
And,
Recording in
again,
progress.
Ryan from Levitt Partners would welcome you to the continuing discussion around smart health cards. This session is specifically going to be focused on what we're calling issuers, those organizations who have the primary data in their systems of this verifiable vaccine information, and being able to supply that information to individual customers. I am pleased to be joined today by Rick Clow, Chief Technology and Innovation, the Chief Technology Officer and Deputy CIO for the state of New York, will be joining us here shortly. Don Messier, the Director of Global Digital Enablement for the Public Health Agency of Canada. As he mentioned to us in the pre-discussion, that's similar to the CDC here in the United States. Janet Campbell, the Vice President of R&D Relations for Epic Systems. Sam Lamson, the Vice President for Interoperability at Cerner.
Interoperability. Connect all your shit. Universal. Here we go.
Product Management at CVS Health. Glad to have each of you joining us today. We want to talk about this idea of issuance. And Rick, why don't we go ahead and start with you as in the work that you've done in California. Give us a sense of why California decided to issue smart health cards, and how do people access their smart health cards today?
I don't know. Maybe because they were into medical tyranny long before COVID-19.
Been able to issue today.
Sure. Thanks, Ryan. It's a pleasure to be here. The original goal was quite simple. We knew, per the governor's announcement in the spring, along with the Department of Public Health here in California, that we intended to reopen the state and relax many of the COVID-related restrictions in mid-June. One of the things that a number of us at both the Department of Technology and Public Health felt was quite likely was that as things started getting back to normal, businesses and their patrons would want to have a way of showing that they've been vaccinated.
That makes me feel so much better.
The only way at the time that anyone had
I just like
that was
getting COVID from people who are vaccinated.
CDC logo on it.
I just love breakthrough
was
case
certainly going to be
transmission. That's
frequently
really
left
my
alone
type of COVID,
or
so
running
it
into
does
water,
make me feel better when I
or
go to
lost.
restaurants. It's great. It's really
and
great.
We wanted
I'm
to have
I'm
a
into
better
it.
answer. So the initial motivation
Fucking
was
stupid
simply
ass.
give California residents
Mm-hmm.
an easy backup copy
Oh,
that would alleviate the concern.
thank you.
That
It's
if
so hard.
damage
It's so hard
was to
to.
a CDC card, they'd be out of luck.
So hard to have a CDC card
We
picture.
looked for options.
So
Smart
hard to
Health
take a
Card
picture
framework
with my
would be
phone. I don't know how to
open
do
source,
it. Like, how do you take a picture
non-proprietary,
of a card
didn't lock us
with
or
your
any
phone?
other
I
state
mean,
that might want to follow
so
our
hard.
lead into a specific vendor's platform to fit the bill.
Let's develop
And
apps
we
because
launched
we don't know how to
in
take pictures.
June.
Okay. Yep. That makes a lot
Since
of
then,
sense. Yep.
we've delivered over 7
Mhm.
million digital vaccine records to California residents.
Wow. My hero.
And it's going up by almost 100,000 a day.
Yeah. Very smart people.
That's
Yeah.
fabulous. Thank you for that.
That's fantastic.
And
Thank you
for
so
your
much.
leadership as well. We appreciate
Thank you for your
it.
leadership. Yes, you
John,
still have
we
COVID
can
in your
return
state,
to
but
you.
thank you for your leadership.
Give us a sense
Yeah,
of
great.
what options Canada explored before deciding on using smart health cards, and then how are smart health cards being used in
What
Canada
did
today?
Canada was exploring gulags and
I know you've
all kinds of
recently
shit
gone live.
before
That number may be a little
the
bit
smart
lower,
health
but give
cards.
us a sense of, again, your role in the Canadian government, and then also the decision-making process that went into this.
Thanks for the question. So there were actually three options that we were looking to do, and we spent quite a bit of time doing the analysis, primarily around the ICAO visible digital seal standard that has been produced, as well as the EU DCC, and then finally the smart health card. So there was a number of factors that went into consideration. Obviously, for us, it was important the broad use case, rather than just international travel, which the other two kind of more focus on, especially on the ICAO side. We're also we're looking at the alignment to international data specification standards, such as HL7, FIHR. The availability, as our friends in California, the availability of open source was really, really important, and the readily available resources to accelerate deployment. So that was a key factor. So speed to delivery, as well as
speed to delivery.
Close attention to what's
so
happening
fast
in the
you
US,
don't know what's happening.
Obviously, you are our #1 travel destination. So we pay close attention to that, and we
let's adopt whatever the Americans are doing so our people can travel there.
Interest in the U.S.
Yeah.
Okay. It's shown to be the correct assumption.
Okay.
So we're very pleased with that.
Yeah, you're pleased, aren't you?
And also the decentralized model. But I would say
decentralization, interoperable,
source, and the U.S.
but decentralized.
I think trumping criteria for us.
Even though they're consolidating power.
In terms of the use,
but they're decentralizing.
As you probably might have heard, but
it's a lie.
Last week our Prime Minister
ridiculous.
Made that announcement that we are adopting that standard. But the reality is that we've been on this for many, many months already. In fact, as of today, we have 14 health jurisdictions in Canada, and of those 14, 10 are already issuing smart health card today.
Well, those 4 are going to cause a ruckus, I hope.
So up to 12. And then the last 2 coming online in the month of November. The last one that we're tracking is on the 30th of November. So by the end of November, every jurisdiction in Canada will be issuing to that specification.
That sucks.
In terms of population, as of today, we already have 87% of our population covered, able to get a smart health card for their vaccine. And the usage for that in Canada is quite broad. Because as you might know,
like the world doesn't know that everyone's going on the same smart health card program, backed by major corporations.
Non-essential services or access non-essential services such as bars, gyms, restaurants. Also, at the end of October, just starting now for all federally regulated transportation. So somebody wants to board a plane, a train, or maritime services, they need to provide proof of vaccination. So the rules are pretty tight. And most provinces
rules
and
are tight.
territories are leveraging smart health cards.
We're not going by any data anymore. It's all about
But of course, for us,
It's all about your
I think the
digital
federal government,
credentials.
Our interest was more on international travel, but there's very broad use cases. As of today, I don't have a clear number because we do not track how many cards have been issued, but it would probably be in the range of 10 million or more, which sounds small number for you folks, but for us, it's about 25% of the population already. And some provinces recognize that they've just gone live in the last couple of weeks. So the numbers are going up, and so that's pretty well where we are.
This is insane.
Thank you.
Absolutely
That's
insane.
fabulous progress, Don. Excellent.
Fabulous
Thanks for that.
progress.
Great
Yes.
background. I appreciate
Yes,
that.
these
Rajiv, thank you
passports
for
are
joining us as
really
well.
battling COVID
We
and making
appreciate
everyone
it.
so safe. Thank you
Rajiv,
so much.
As you're kind of getting plugged into this conversation, I wanted to turn to you in the state of New York. Give us a sense, you were very early on in this process, and you've obviously had a lot of
In
things
2019, New York was trying to pass legislation that made vaccinations mandatory for adults. This was in 2019, before COVID. And they were also trying to pass legislation where they were giving vaccinations to children without their parents' consent.
Hello to everybody on the panel.
Just a little background on New York.
So you're right. We started early on in late December of last year.
Mm-hmm.
We started to hear rumblings about needing some technology that would allow us to provide proof of vaccine.
Oh, you heard that in December of 2020.
Reopening of New York.
Really?
To have something like that.
I don't know, man. They were talking about that long before December of 2020.
The idea they could go back to trying to be normal in their day-to-day lives. So in March of this year, we released a version of our digital health card.
That was fast.
That was very closed. It was a closed-loop system, only because we didn't really have enough exposure to what the industry was doing or where anybody else was going or thinking about it. So to dip our toes in the water, we took a very small step in that direction.
Yeah, this was we just improvised this global system. We just improvised. We just made it up on the fly. This is all just improvised public health measures. Yeah. This isn't carefully planned over years. Jesus Christ.
That health card was confirmed proof of vaccine and was issued by New York State. So two things that helped us get there was we controlled the data.
Yes, you did.
Immunization records.
Yes, you did.
State. And so we could authoritatively issue those cards and confirm them as well. So in March, we got there, we released it, we saw good traction. Businesses were happy to be able to leverage it, especially the sporting arenas and such.
They were so happy.
But very soon we started to get into a situation where the use cases were just not reopening anymore or stimulating the economy. It was travel. People started to want to travel across state lines, travel internationally. And so we started to open these conversations with our neighboring states as well as internationally with a list of countries, including Israel and Greece and Iceland and a bunch of the others.
Israel?
And we quickly realized that we were not going to be able to do this one-for-one, negotiate an agreement with each of these states and all countries and then try to build a system that allowed us to be able to interop between these states and countries. And so we knew we had to change that direction and go to a direction that would kind of morph itself to become a standard of some type, and hopefully, gain traction across the country.
Traction.
And so,
Yep. Adoption.
We decided to partner with VCI on that framework,
Did you?
And we released Excelsior Pass Plus. Now the difference between
Excelsior was made by IBM.
Excelsior Pass Plus was a closed-loop system that just said yes or no whether you were vaccinated to now a full health credential, a full immunization record, right? Because that was a requirement in talking to other countries. It was not enough to just say you're vaccinated. They needed to know what, when, how many days, all that stuff. So
all of that stuff. We need to know when you took your last shit. We need to know last time you took a piss, last time you took a shower, last time you pet a dog. How many kids you have. We need to know everything about you, basically. We need to know everything about you.
We're seeing about 600 million uses already of that pass, and growing as the vaccine mandate changes to 5 to 11. We're going to start to see more coming down that pipe. So that's
yes. Let's get vax passports for little kids.
Scanner was the other piece.
Let's put it on their backpacks. It'll be great. Fantastic.
Give the businesses the tool to do the validation and the verification, knowing that if that said yes, or that was a green check mark, that it was something the New York State gave them, that they would safely admit people into their businesses and stuff.
Oh my God, green check marks to save the world, guys. If I have a green check mark, I mean, I'm just so safe to move about the world. I mean,
and we had 2 separate lines where they were using the normal process of checking people's test results on paper and or CTC cards, and then we had a line where people had an Excelsior pass. And so that transaction was like a 1 to 3 seconds versus a long queue on the other side.
Oh, there's a long queue if you go with the traditional cards. Yeah, it's just easier for access, and it's just so convenient to get this, universal digital identity, guys. It's just so convenient. Convenience. We don't live in convenience culture, do we? Oh,
Oh, one more thing.
We have Starbucks on every corner in New York, so of course we're going to get the easy app that allows us to do things easier. That's not a trap, guys. That's not a trap at all.
How we learned what we did away to anybody, any state that's interested in learning how to get there. We're happy to collaborate with them, work with them as much as we can, consult with them, whatever it takes to get them to where they need to on the digitization.
This is crazy. Absolutely nuts.
Really helpful, Rajiv. Thank you.
So helpful to know that you are fast tracking digital prison. Thank you so much, Rajiv.
California, as it relates to the source code. You want to mention that as well? I think it'd be important for folks to know.
Yeah, thanks, Ryan. For any states that might be listening and wondering whether there's an opportunity to do what we've done and join the 5 of us that as states are issuing smart health cards, a little over a month ago, we took all the code that we wrote. So we developed our issuance of smart health cards.
Open source.
Internally built in-house.
Trust.
We turned around and put all of that code out in the public domain.
Oh my God, thank you so much.
So that any state that wants to take our system and put it on top of their own immunization registry can fork our code on GitHub today.
I mean, open source digital prison, guys. I mean, this is just cutting edge and very smart and greater good, build back better, new normal, great reset. It's amazing. It's amazing.
The first of what we expect, or many states went live this week.
Oh my God.
Using our code.
Oh my God, thank you so much.
Immunization registry. So
aren't you proud?
Well, today there are 5 states issuing smart health cards. Technically, a 6th has quietly launched.
Quietly launched. Let's all smile about that. Quietly launching. Yeah, this is not sneaky at all. Not sneaky.
We put a link in the Q&A so that if any other state is interested, there are some details there, and feel free to follow.
How do I say fuck you?
Turn to you at Epic. For those, we've got a worldwide audience here. Many of them may not be familiar with Epic. Give us a sense of Epic and the background there, and then how individuals can use the MyChart platform and the app to be able to access smart health cards from around the country.
Yeah, thanks, Ryan. For those of you who don't know who Epic is, we're an electronic health records developer. We work with a number of healthcare organizations in the United States and actually across the world as well. And MyChart is Epic's patient experience platform. Basically, it's available on web or on mobile. It's used by over 100 million people now in the US and actually across the world as well to access their medical information in a way that's patient-friendly and patient-facing. But I think part of the challenge is that when I log in,
so I'm writing a question. Can you explain what digital health cards do for public health? You haven't proven any of this is actually for public health.
People weren't waiting to go to their primary healthcare organization to get the vaccine.
And they can see that in the Zoom chat in the questions.
Now, we knew at Epic that this Smart Health Card initiative was going to take off and that patients would expect this in MyChart. charts where you get all of your health information. So it makes sense that having a verifiable proof of that information would be available there as well. And seeing incomplete information in my chart was going to be a huge dissatisfier. This isn't just a problem actually for patients. It's a problem for healthcare organizations as well, who try to plan proactive outreach. And those immunization registries that we heard about in the previous session, they can act as a source of truth, but healthcare organizations can't just query them to get all of the most up-to-date information for all of their patients. And I mean, they literally cannot, because we saw some organizations try it, and just the volume of queries actually caused real performance problems for those registries. So that's the problem, right? Patients want their information and they log in and it's not there. And while some states,
patients really don't want their information, guys. They don't really give a fuck. They just want to live their life.
And that just
hate to tell you, you're forcing them to want access to their information because they have to have access to their information to live their lives.
They already have functional.
This is manufacturing consent 101. Backed by a public-private partnership that's going global. This is way too obvious.
A patient logs into my chart, they see that blank COVID-19 activity that says that they're not vaccinated, but now they see a way to rectify that, to check for outside information.
Oh my God.
And behind the scenes,
I don't want to be an anti-vaxxer. I don't want people to think that I'm an anti-vaxxer if my app says I'm not vaccinated. Oh my God.
There I can access my smart health card. And the
mass media and groupthink taught me to fear being bullied for not having a vaccination. Shut the fuck up.
It's really a win-win. I've got
really a lose-lose, but thank you so much.
From the MyChart app, I don't even have to log in. Plus, my organization has a better understanding of who their vaccinated patients are without having to take down the registry. And I'm not calling their helpline confused because I can't find my information. It's been a really big success since we launched last June. We first went live.
Yeah, is COVID gone?
Champions at
no, right? Great. It's been a great success though, because people can.
Their CIO, Chris Longford,
people can download this shit.
In this technology and help push it forward. But from that one organization, we now are live with 59 million patients who have access to their smart health card in MyChart. And as of next week, we're going to be covering all 50 states. We think it's really important to encourage this adoption across the country. So to make it easier for patients to know where they can get this information, we publish a list of participating organizations who've turned this on for their patients in MyChart. So if you're listening and wondering if your provider offers this, you can actually go to mychart.com/COVID to get that full
right away.
list.
Right away. I'm on it. Thank you so much.
Janet. Sam,
thank you, Janet.
From your perspective,
damn it, Janet.
Give us a sense of who Cerner is as well, and the work that you guys are doing.
Yeah, who's Cerner? Who's this?
In terms of providing
the new kid on the scene.
Sure. Cerner is a comparable organization in that we provide electronic health record technologies and services to healthcare organizations across the globe.
Great.
We provide a whole litany of other services and technologies as well.
But the VaxPass is definitely number one right now.
Our approach to
not that it'll help people.
Smart cards, we're just really excited about the rapid adoption of
rapid adoption
among patients who receive their care from
yes, because all these smart cards are really battling COVID. Yep, that's great.
Quickly, from the restrictions
everyone's
of COVID-19, and today we've had through our clients. The retrieval of over 1 million smart health cards from patients through our APIs. And you asked about the process of patients actually getting access to their smart cards through a Cerner client. Typically in general, the patients don't actually know whether their clients or whether their healthcare provider is a client of Cerner's or not. And so they really typically will go through the client's patient portal or the portal that's branded by the client organization, and when they are in there, they will get the option to pull down their smart health card quickly and easily upon logging in, and that is typically how
it's just so easy. You should just do it because it's so easy. It's going to help you. Yep.
And last I checked,
88%
of the smart health cards that we have issued were requested through the patient portals of our clients. But there is a rapidly growing number of requests coming through the open API through third-party applications.
Okay.
The standard is simple, it's secure, and it's easy to integrate. So we think that there will be a continuation of seeing the prevalence of third-party applications connecting.
Yes, just plug into this digital prison that we're building. Just plug in. It's interoperable. It's open source.
This is coming.
It's completely unnecessary, but you should plug into us, guys.
That it does support the ecosystem. And really,
crypto's the same way, guys. Use our digital currency.
Collaboration and
put it in your wallet. It's interoperable. It's great. Trust, access, community, buzzwords.
And so that's a summary of how patients can get their smart health card through a Cerner.
Like literally no one wants a smart health card except for like the crazy shit libs. This is nuts.
Lighting up, consumer first applications.
I don't want to go around showing everyone my fucking medical history. I really don't.
Thank you, Sam.
No interest whatsoever.
Turning to you, why did CVS Health decide to issue smart health cards directly, and what value has
CVS did they
for its customers?
Yeah, great. Thank you for the question. And for those overseas who don't know CVS,
because it's money, bitch.
Healthcare companies.
CVS is a corporation.
The response was COVID testing, COVID vaccinations. I think we're well into 30
if they have to require 1 million vaccinations for no reason whatsoever, CVS makes a shit ton of money.
CVS has always offered records of vaccinations.
Dumb fucks.
We always offered, an email summary, full vaccination record, and people would use that to write proof, for example, to schools or somewhere new.
Yeah.
What was new with COVID was this notion of digitally verifiable. For the first time, there was going to be an ecosystem of verifiers.
I need to know how many needles you've had in your arm, and I need to digitally verify that.
So there was massive uncertainty. I cannot emphasize this enough about, when COVID vaccines first came out. And
massive uncertainty. Of course, there was massive uncertainty, but we're working out the bugs so you can have your universal digital identity, guys.
We spoke to countries.
We're working really hard to make this, to build trust and to provide access to people and build a community.
It came down to a set of principles
backed by interoperability.
So
buzzword. But don't you want to share, easily share interoperability? Don't you just want to share your vaccination records and everything that you own with everyone with a click of the with a click of a button or a flick of a wrist? Don't you just want to share everything?
All of that work and effort and
yes, CVS.
Many different teams and organizations that centered around this that really wanted to
so many organizations came together, this community of people coming together to build this interoperability network so we can build this trust and give access to this thing that no one actually needs. No one actually needs this, and all these people are collaborating.
We hear
from all of these people are collaborating.
They don't have to create a
crazy shit.
They don't need a new username and password. They can just get that record via the email or via their existing account. They're also enjoying that we brought together test results and COVID vaccination records into one place.
Let's put it all in one place. One place. And if you don't have that thing with all of your stuff in one place, you don't get to access the world.
They were asking for this. So even a few weeks before we issued the QR codes, our voice of customer
QR codes told you.
Where's my QR code?
I need my QR code. Yeah, now we care about QR codes. We didn't care about QR codes before COVID. It was basically dead technology. It was obsolete. And now we're using QR codes to manufacture consent for a universal digital identity. So obvious.
And we're going to be, as Rajiv mentioned, it is just the beginning for us. We're now looking at the boosters, minors.
Stick them in the kids. Stick them in the fourth shot for grandma. Boom, bang, boom.
That was awesome.
CVS makes tons of money.
We're getting a lot of questions here about individuals that want access to a smart health card. I think key to this is, number one, it's still getting rolled out.
I asked why they exist and what they do for public,
you mentioned if someone has
been for the public good, and he's taking questions about people clamoring for smart health cards. Get the fuck out of here, bro.
You had mentioned earlier, just reiterate for the group as well. Even if they did not get vaccinated by a provider that has.
Where's my question? Hold on.
They can actually log into my chart to be able to access their credential from any of the providers who have Epic and any of the 50.
Let me see if they answered my question in the chat.
Summary.
Yes and no. We can retrieve that information from the.
Do they remove? No, my question's still there.
And interoperable connections between both Epic and other organizations like Cerner can pull in even more information, even if that.
I'm typing in access, interoperable.
Okay. So if I'm in a state that is not currently issuing smart health cards, but I have a provider on Epic, for example, that is in my state or that I have a relationship with, I can
what's
actually
another
log
buzzword they've
into,
been
as long
using?
as
Access,
that provider is
interoperable,
connected to the IIS,
trust.
Then they can be able to access that on my behalf.
Access.
Okay.
And if you don't mind, I'd like to add
Community.
a little note of where things are going. I think there's also the option for people to just ask their doctor to print one out for them. So that's something that we'll.
You can just have your doctor print it out. Oops.
Early next year.
Someone's gonna get fired.
The ability to just walk into your doc. They're connected to the IIS, connected to the.
Sam's gonna get fired.
On file.
Bye, Sam. It was nice knowing you.
Operable immunizations available through other health systems sharing records. That whatever COVID vaccinations are found on any of those sources should be able to convert to a QR for the patient in office.
Got it. I think. Go ahead.
One thing there, Ryan. So the important thing here, we don't need to lose keep sight of, is the fact that you have to be able to make it easy for verification. You need to make it.
In the Q&A, I'm sending access, interoperable, trust, community. These are buzzwords. Health cards don't stop COVID. This is about control and extracting profit. Boom.
Because of a mandate. But these things are important that when we put systems out there, that we are looking at the impact it's going to have on the business, on the reopening, on travel, and whatever it is. It's not enough to just say easy access to a health record.
Easy access.
Yes, it's definitely available. You go to your doctor.
Oh my God. The script is so obvious.
The output in that format is not very conducive to some of the other use cases that we want to talk about. And so I keep that in mind in terms of making sure we have multiple options in terms of output, and we strive to continue to make it easy to reopen and move forward and get back to normalcy.
So I will
end
in this 30 seconds, which is
we're fast tracking adoption of digital vaccine passports, universal digital identity, and talking about getting back to normal. That's not normal. That's not back to normal. That's completely different.
And Sam, thank you so much for joining us.
The conflation here is crazy.
And we
absolutely nuts.
To go back to the lobby and rejoin the final session as well. So thank you and have a great day.
Exactly, Tyson.
Thank you, everybody.
Mental illness will skyrocket, and then you will need your medication for your mental illness. Oh my gosh. All right, there's only one more panel. Thank you for watching. Thank you for sticking with me. Please give me a shout out in the chat if you're there. Whoever else is watching with Tyson at the moment. This is nuts. That one was crazy. That one was absolutely crazy. CVS chiming in like, oh, why did we do this? Because people just wanted access and they wanted a quick way to do this and other QR codes, and it doesn't even make sense. Oh my God, this is a huge one coming up. State of Hawaii, Royal Caribbean Cruise Line, UC San Diego Health, Care Journey, United Airlines, Mayo Clinic, ServiceNow, Delta Airlines, California, Salesforce, and the Commons Project, that little startup that was founded just before COVID, but then they're like, oh, we're going to be the leader of smart health cards. We're just a startup. We don't know what's going on. Yeah, you fucking liars. This is crazy. All right, this is the last panel.
Recording in progress.
Health systems and others, the smart part of themselves, ways of carrying smart cards.
Let me pull this up. Give me 1 second.
How you can carry smart health cards.
God, they start these so quick.
And this panel is going to really focus on verifiers, which are the organizations that are really relying on smart health cards. We've obviously also talked about the Common Trust Network as the sort of trust enabler to be able to ensure that smart health cards were issued by trusted sources. Just quickly.
Sassy. Oh, this has nothing to do with public health. Not one of these smart cards has helped a single person. So this has nothing to do with public health whatsoever. This is about connecting your whole life into one digital wallet. Has nothing to do with public health.
what
Absolutely nothing.
So we're gonna talk
Smart
about
Health Card does not prevent COVID from spreading.
Brian,
Smart Health cards do not prevent vaccinated people from getting COVID. It has nothing to do with COVID. They're going to move on from COVID. As soon as COVID is kind of in the rearview mirror, they're going to pull out whatever the next trick is. If people are buying into this, this is crazy. This has nothing to do with public health. They have not even proven. They have not talked about public health in this whole. How do you do a 2-hour forum on health cards and not even talk about public health and how it helps public health? This is not about that. This is about access to things. This is about controlling things, controlling movement, attaching things to your wallet. No one's even talked about how we can save lives. This is crazy. This has nothing to do with public health. How do you have a 2-hour forum on public health and you don't talk about public health the entire time? You're talking about tech. No, wake up. Yeah, they care about our health, but we have half a country in medical debt, and they're not even pushing for single payer health care. They don't give a shit about your health. This is about control and extracting profit.
The first was that
look at the horrible corporations backing this initiative. If this is for the greater good, Microsoft wouldn't be attached. MITRE wouldn't be attached. Hello.
The second is that while the state's issuing it for digital
yeah, this is crazy.
We actually also issue ours for PCR test verification, which is part of the standard as well. And that became really important because we have a lot of people who leave from San Diego for the state of Hawaii.
I know you're kidding, Sassy.
And
I just used your
smart health cards,
your message as a prompt to rant because I am Ricky Rants and I wasn't ranting enough. Who is this guy?
To travel to the state of Hawaii.
Oh, the Hawaii guy.
For verification. So,
oh my God! If you want to go on vacay to Oahu, I mean, get your vaccination passport. Hawaii is like a different country, even though it's the 49th state.
And then in August, interestingly, the California Department of Public Health issued a notice on August 5th that starting August 11th,
Sassy's cool.
all visitors to hospitals would need to be vaccine verified. And so that gave us a very short runway of 6 days to put in place the processes to make sure that those visitors to our hospitals were vaccine verified or had a recent negative test. Now, there were various restaurants and counties in the state of California.
Yeah, to go to the hospital, you have to be vaccinated. To be treated for COVID-19, you have to be a vaccinated person that gets COVID-19. That's happening more and more around the world. That's hilarious.
Visiting a loved one at the hospital. And so when this went live Wednesday, August 11th, one of the things we did is we put flyers at every hospital entrance with a QR code to make it easy for any individual who had not brought their CDC card to download immediately.
Oh, it's just so easy. It's so easy. So why wouldn't you do it? You can't taking a picture of a CDC card is so hard. I just don't know. It's so much easier to scan a QR code than take a picture of a CDC card. I just don't know how to do it. I'm so helpless. I need convenience. Oh my God, standing in lines. Why would I want to stand in line when I can scan something and pull up my application?
Preferred to do vaccine verification using the smart health card.
Yes.
It doesn't require any level of
are these people all brainwashed? Where do you get all these fucking clowns?
Does this look real? Is it fraudulent? And so the staff really prefer.
All right, what should I write to these guys? Give me some ideas of what to write to them in the Q&A. They won't ever answer me, but it's hilarious to write it where other people can read it.
To digital only vaccine verification, and at what point will we here in the United States consider something of that nature?
Yeah, sanctions on the poor. America's already perfected the sanction on the global community. Let's do it locally, huh?
Now issuing smart health cards.
The Commons Project. Where'd they get all this money? This little startup that happened to just stumble into vaccine passports right after they were founded. So fake.
Still on mute.
Aloha, everybody. Can you hear me now?
Yes, great.
Oh my God.
Okay. Just take a second and imagine yourself on Waikiki Beach with me with white sand.
Just imagine the beach and the Corona beers and the luau's and the pigs.
There's no people.
There's no people because they don't have the vaccine passport. You got to have your vaccine passport to go to the beach.
When the pandemic reached Hawaii in March
Fuck
2020,
you.
the governor issued a quarantine order.
Hawaii's going to be underwater. They're going to create a fucking climate change tsunami, and you're going to be wiped out anyways. You better seek mainland, buddy.
But we had to have this quarantine for public
Nacho
health.
Libre.
What happened?
Get that corn out of my face.
Over 20%. We were the highest unemployment rate in the country, and our tax
Nacho
revenue were up by 25%. And we're a small state. We couldn't really absorb that kind of tax revenue loss. So the governor and all
yeah,
of
they're
us
like,
started looking right away.
yeah, oh my God, vaccine passport. Let's go. Beaches, yeah.
People come to Hawaii.
I can just go to the fucking beach. I can just go there. What are you gonna do?
The vaccination requirement.
Early morning optimism. Yes, I'm so optimistic about the future.
Economy at the same time. So we built this safe travel system for people coming into Hawaii. Some of you may have used
safe travel. Safe travel.
Yourself as you come in and put in your
be careful.
PCR test.
Be careful.
Record.
Be careful with what you say.
Then along the way, as we started to want to be able to verify,
got to show your papers.
We built smart health card issuance into safe travels and have it as a possible way to show you've been vaccinated. And we also have had counties that have kind of shut down restaurants for a while and made it necessary to show some kind of proof of vaccination.
Oh my God.
PCR test. So of our
I was at Rosa Mexicano yesterday.
It started issuing smart health cards, but for all
it was great.
We make it an option. So you can use your smart health card, or you can use your CDC card, or some other document that shows you've been vaccinated or tested. And I think that sort of soft adoption standard has been very helpful. So by digitizing everything, travelers come into Hawaii.
You're forced into a digital lifestyle.
So we just about doubled that record.
And we can delete you whenever we want. We can pull the plug if you're a bad person. If we don't like what you're doing, if you're a domestic terrorist and you're protesting.
And a big part of our interest in smart health cards is that other states like California and other issuers are issuing smart health cards. And so those California is our biggest market in terms of people coming into Hawaii. So
yes. A lot of people lay over in LAX before they head over to Hawaii. That makes a lot of sense. Yes. Very good. You know that medical tyranny in California is really gonna translate to Hawaiian business. That's right.
Sure,
it was the Trump vax last year. No shitlibs wanted to take it. Now they can't have enough. They can't have enough shots in their arm, and they're still getting COVID. Oopsie poopsie.
First and foremost, it's patchwork of standards around the world, and literally every country can produce their own documents, and especially very early on in the pandemic, it's very difficult to establish what would be accepted, what wouldn't be accepted, and how do we
what is acceptable,
deficiencies.
We get to tell you what is acceptable with your life, your body,
January,
your digital identity.
We've verified approximately 9 million COVID-related documents to facilitate travel. So it's created, quite a bit.
Release a bioweapon and you can get people to do anything. But they were conditioned years and years in advance. This was years in the making. Many years. Lots of work.
A few weeks ago, we were able to...
Sassy says, I think my doctor's office started something similar to this wallet thing. Brigham is buying up hospitals everywhere and putting in a database that runs across all of them and holds all patients' info. Brigham is the health network? Is that the name of the hospital network where you are, Brigham? Let me know. I was talking about Event 201 earlier in the stream.
It also gives our verification process more credibility, especially when we're.
And yes, Event 201 was part of the planning for this, obviously. Way too obvious. When Johnson & Johnson, who had not made a vaccine ever in the history of the company, shows up to Event 201, something's happening.
Except the paper CDC card. So it's really, becoming a key that's going to unlock, different experiences for our customer.
Oh, the key, the access, key, the key. The key to New York, like de Blasio said in that fucking weird ass stream where he was eating a hamburger because they were giving away Shake Shack if you got the vaccination. He was like, yeah, this is your key to New York. It's a hamburger. It tastes so good. Vaccination tastes so good. Fucking weirdo.
See, if you're coming from the United States or Canada.
Oh, Singapore. Aren't they one of the countries that has a high vaccination rate, but also COVID is spiking there right now? Let's just talk about Singapore and how everything is going so well for Singapore right now, right, guys? We live in clown world. Let me get some clowns in the chat. I want to see some clowns in the chat.
Or CVS or some of the other trusted issuers, and not, my favorite example, Paul's Random Back Shop, which again, part of the rationale for a trust framework to rely on for verification. So let me just now ask Mahesh Gupta from Delta. Mahesh, obviously you're also verifying smart health cards, and would love to talk about kind of your perspective on this and the benefit of verifying smart health cards and relying on a trust framework.
I think, Paul, by the way, good morning, everyone. It is the same theme for all of us. How I think Doug was talking about that, how disaster situation was there. I think Chris was also beautifully saying is that when are we going to be completely digital? I think that's what we all are aspiring for. Just give the journey back to the way it was before COVID. If not completely, but at least.
This doesn't bring you back to the way we were before COVID. This is a huge lie. I can't tell who knows they're lying and who actually thinks that they're helping us go back to the way we were before COVID. I actually can't tell. I think a lot of these people are brainwashed.
Accepted according to CDC, then we do an AI analysis and.
Oh, you can hear me typing? That's creepy.
Out of individuals and let the computers do as much as possible and.
Mass General Brigham. All right. Hold that thought. If you're here after the panel's over, we'll take a look. We'll take a look and see if we can find Mass General Brigham.
AI guesswork out, because even within the AI, we're still making a guess of what is that information looks like. But with this one, we are talking about exact same data that was the way it was entered into the system. But Paul, I think you touched upon that. One more key piece of it is that while the data is being transmitted in a QR code format as an SFC, is it coming from an authentic source? So the two aspect of it is very important.
Authenticity. We don't want those dirty, unvaccinated people sneaking into places like Rosa Mexicano and having a great meal and spreading absolutely no COVID whatsoever because they're not sick.
Whichever way they were interacting with us, they can still upload their PDF from CVS or from Walmart or from any place of the state of California. But if there is a QR code, then we just leverage the QR code, because now it is much easier for us, and the amount of time it takes to validate a passenger when they are uploading this information is also phenomenally reduced. And if it is not there, then we continue to do it. And
trust, access, community, interoperability.
Just uploading the QR code is when we can call it here all this stuff. So that's basically it.
Great.
All right. Well, I'm gonna in the Q&A.
To Cesar Caldera from Royal Caribbean. So you want to talk about how you're incorporating it?
You keep talking about going back to normal.
Most definitely. Thank you, Paul, and good morning and good afternoon to all. I think I speak on behalf of all the verified.
By drastically changing people's lives.
The last year plus, the last couple months has been a very.
Do you know
to make sure that we get to where Magesh is
that you're being
our processes
disingenuous?
As possible for our guests. We already have our apprenticeships.
You keep talking about going back to normal by drastically changing people's lives. Do you know that you're being disingenuous?
Show proof of vaccination.
And that's in the chat.
Those 14 days before they sell. As such, we kicked it off with enabling our guests to upload a vaccine card image, CDC card image, through the check-in. Very simple, 1 to 2 clicks, take a picture, upload it. And behind the scenes, we have humans eyeballing it and verifying it. And again, I think like Chris mentioned, it could be fraudulent, it could be missed. So we're now getting prepared and ready to now transition to the Smart Health Pass process, using the API to verify the information. Some of the benefits that we see there is efficiency. It's going to be quick. It's instantaneous. If the guest uploads their QR code within milliseconds, we get a response back as approved or denied. It's also scalable. We're in 6-digit transaction volumes right now.
This is crazy.
Sending with us will be in the 7 digits.
We could tell you. I can tell you in a millisecond if you're clean or dirty.
Process that's authentic, it's verifiable, and it's expedite it, it's the way to go.
Yeah, how many boosters will we need? These people don't even care. They don't even care. They're just, we're going to build this thing and it's going to be great. And then we'll let the oligarchs tell us, you know, what's the appropriate number of jabs. Yeah, great. We don't even know if this is going to do anything for the virus. And, you know, once we've exhausted COVID-19, we'll just, you know, take one of those other viruses we have in the labs that we spent millions of dollars to create and just release another one. As long as everyone's bought into this, that's what's going to happen, guys. It's pretty obvious.
Be happy to do that. And I want to build off of the similar problems that Chris and Douglas have talked about.
What are the problems?
Immunizations were never really designed to do what they're being asked to do. So we have to be fair to them as immunization registries.
Be careful. Don't lose your job.
We're both an issuer and a verifier.
Be careful, Dan.
Communities to reopen using
Don't say the wrong things.
Process. So we work with different populations. We work with farm workers, the disabled.
Absolutely. Fully vaxxed will change every 6 months probably. There'll be a new definition of what fully vaccinated means. And it's not helping at all.
With trust. They don't trust the government. They're very mobile, so they need to go to different locations. So as we work with Microsoft and the Vaccine Equity Initiative with
we'll look into it if you're still around. I'll look into it anyways.
We're now helping those populations and educating them to give them an option to the CDC card, which they, as they go to different
an option to the CDC. We don't need an option.
They lose those cards.
If people did get vaccinated and they have a CDC card,
so now
they don't have to worry about losing the card. They can just take a fucking picture of the card, bro. We don't need your fucking digital identities, digital passports. No, this is not an option. This is bullshit. Daily pill, fully vaxxed. Yeah, the daily COVID pills. Boy, that's a way to make everyone poor real quick. That's a way to make every major pharmaceutical company a $1 trillion company that essentially owns small countries and has complete control over the general populace. That's the way to go. Yeah.
The vaccinations to them.
Yeah.
So these the people. This is that large part of the population that will not go to healthcare, can't get to a mass vaccination clinic, and have a distrust of government and large systems together with that. So as we move forward with this,
good reason to have distrust of government after the past 18 months.
It's working so well now that through the Vaccine Equity Initiative, we're now helping other states that are learning how to do this and asking to learn best practices. You know, so we look at working and partnering with like Hawaii and UCSD, who has had a long relationship with us, on how we can improve these processes and share them not just domestically in the United States, but in other countries around the world.
Hello, new people. Say hey in the chat. This is crazy. This is the last panel for the Vaccination Credential Initiative's Smart Health Cards Global Forum. Hey, Allie. Welcome to the Digital Hellscape.
Thank you, Paul, for the invitation, and honor to be part
Holy
of this
shit.
great panel and the event in general.
It's been crazy, Allie. It's been crazy.
So Salesforce, two of our core
Salesforce.
Trust and equality.
We've seen Apple. We've seen Microsoft.
Using the power of the platform.
We've seen the MITRE Corporation. Now we have Salesforce.
And I'm very proud to be leading the vaccine cloud efforts, which our platform has enabled over 110 million vaccines. And we're now,
oh my God, just so many needles. I'm so excited. I'm so happy about all the needles.
Salesforce as an employer, our employees want to get back together in person. And I think the world wants to get back together in person very safely.
Oh, yes. Let's go back to normal by changing what normal means. That makes so much sense.
Protocols that each organization is deciding to take.
MITRE and Salesforce. I know. Public-private partnerships and all the fun we've had today. Oh my goodness. Oh my goodness. We're all in this together. That's right, Cadillac Jack. That's right. We're building community with this interoperable technology that builds trust and grants access. We've heard those buzzwords all morning. Access, trust, interoperability, community. Bullshit, 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 bullshit. 2 weeks to 2 weeks to slow the spread. Put on a piece of cloth, and then we're gonna slow the spread. Maybe we'll do vaccinations for the at-risk populations. Maybe you will be vaccinated for the rest of your fucking life and taking pills too. That changed fast. Now you need a digital identity to go places. and do things. You have to buy into their bullshit to have access. We're granting you access so you can have access to life. This is fucking cuckoo. This is like, this makes Nazi Germany look like small potatoes. This could be global Holocaust. This could go really, really, really bad. Flatten the curve. What a joke that was. What a joke that was.
And we've built an end-to-end product that goes
end-to-end, you know, it's interoperable, you know,
to the digital credential.
We're doing open source,
making it turnkey and simple.
Turnkey and simple, you know, access, trust.
To bring people back together safely.
Safely, and
you know, it is
community.
Amazing to bring people together after
access, equity, yes. Trans rights, black people, yes. Everyone's gonna live happily ever after, yes. In this utopia, transparency, interoperability. Yeah, open source.
Not just for our own employees, but as part of the Dreamcast product that allows all of our customers to take advantage of making it the most convenient way for a person.
Convenient, because it's convenient. You know what? Those pesky CVC cards. Why would you want a pesky CVC card? I mean, it's so hard to take a picture of the CVC card. You have to have this interoperable, trust-based, accessible access. See, she said it. Took the word right out of my mouth. Access. You can't just take a picture of a card. It's just too hard to do that. You have to have this trust-based, interoperable, transparent system. It's so convenient. I mean, mass adoption. It makes so much sense. Guys, this is I can't kill me.
I think you just can't beat being together.
Thank you so much for your insight and your community building, Salesforce. Thank you so much.
Would love to share your perspective on ServiceNow and how you're incorporating smart health cards into your branch platform.
Absolutely. Excuse me. And to Meredith's point, it's great to have another technology partner represented.
We're going to put them in the homes. Yeah. What about the elderly who don't do digital anything? We're going to force them into the old person's homes and give them COVID and kill them. That's what we're doing with them. So thank you for that question. It was a good question, but we're killing them. Basically, that's what's happening.
The invitation. We view our now.
If it's anything like India, where old people that don't know how to use technology or are confused about the technology there with their digital identity, they just won't get their rations of rice and they'll starve to death. Those old people are starving to death in India. So, and here we force them into old folks' homes where they catch COVID because they're not separating COVID patients. Just killing them. I guess we've slowed down on that here because people found out, but that's what we were doing last year.
Helping their employees get back to work through, proof of their vaccine status.
No, I didn't see Jimmy Dore's
returning back to work
skit with Mike McRae last night, but I'll check it out if he reposts it.
Their proof of vaccination. That's what we're about, and
that's what we're about. Proof of vaccination. Like who is about that? Like, what the fuck?
Businesses and governments and frankly people.
That's your business model.
More,
creepy.
They expect more, and they want processes to run much more efficiently and effectively.
Efficiently,
and the smart health card is
it just streamlines it. It's interoperable. It's there's trust. There's grants access. Oh my gosh.
You mentioned Canada.
That's what we're about, right, Allie?
We have robust presence in Canada, and we look forward to.
Yes, this is not a local solution. This is a global. Because how are we going to travel to Canada if Canada is not on board with this initiative?
Thank you so much for having us, and we look forward to.
That's a way to get mass adoption, right? Create a global problem and then a global solution, which was all pre-planned clearly because everyone's in on it, whether they know it or not. Robust. That's a good one. That's a great adjective. We've created this robust system in a matter of days.
A couple hours on this.
Years.
But I do want to go and ask John Halamka, one of our other BCI steering committee members from the Mayo Clinic, to talk a little bit about smart health.
See, the thing about innovation that it's been sold to us as something that, like, if you have the resources, you can do it in seconds. Like they rolled out a vaccine and so fast, even though they were working on this years in advance. If you look at like how fast Microsoft grew, It's because they were connected to like the military, and the military had been developing technology for years prior to that.
You can guess where I put it.
You know, like these companies that don't just pop up overnight. Innovation is not that fast, and they make it seem like it is. So when this comes so fast, you're just like, wow, they must know what they're doing. Let me buy into the system. They seem like they got it together. No, they've been developing this for years. That's the trick. Innovation isn't that fast. It really is not.
Standard for transmitting information and verifying that information empowers us all to get back and to life and work. I've talked to government, academia, and industry leaders.
Academia.
This is about empowering individuals with choice. We are simply giving.
I already have choice, motherfucker. How does that give me? No, I'm gonna type this shit in the chat. Fuck this man.
Whether it's a vaccine or a lab test or other clinical data, what's appropriate and consistent for them. So truly, I think of smart health cards as the most important catalyst to get it back to life and work. Turn it over to Anita.
John, the mic drop of the 10 million going live was quite impressive, and I don't know if I can follow.
I said we already have choice. Digital prison doesn't give us choice, does it?
Sector hat, and that is to remind everyone.
Now does it? Now does it? That's very condescending. We already have choice. Digital prison doesn't give us choice. Now does it?
Governments mandate technical standards.
Send.
It's been bedrock in U.S. policy for decades, and I want
I'm such a little dick on here. I love it.
Event in many ways solidifies the obvious industry consensus.
Yeah, who the fuck asked them to empower any of us? No, fuck you. Fuck you.
Access to this vital information, and I'm grateful for all the voluntary efforts and stakeholders along the way.
I'll put that too, Ali. We don't need your permission or help to be empowered.
This is how policymaking should work, and I'm quite positive and hopeful.
Thanks, winky face.
We'll scale the voluntary consensus standards as we've done in the past. So thank you for everyone for your hard work, and I'm excited to see the benefits to the global audience.
Great. Well, this has been really just an extraordinary discussion. I might just give
this is extraordinary.
Once again, Chris, you
extraordinary discussion on how we're creating digital prisons for everybody on the entire planet, not just locally.
And healthcare operability. Any thoughts? And then I do want to come back to you, Anish, for one final comment. I love your comment, but also
love the colors. Yep. You can actually build with this interoperable open source system. You can actually build your own digital prison, and then you can design it. You can do the interior design of your own digital prison. How cool, right? You can create NFTs and sell digital art in your own digital prison. It'll be great.
Yeah, thanks, Paul. So, in addition to serving as our chief,
how is it empowering us to put our lives in the hands of a corporation in private-public partnerships? Yeah, I don't know, man. I do not know.
Not just COVID vaccinations, but really all vaccinations. So many of us are parents. We've had the experience of registering kids for school, summer camps.
Oh, schools, yeah, vaccinations. Our robust vaccination schedule in America, which doesn't exist in a lot of major countries, and they don't have crazy outbreaks every 2 seconds because sanitation reduces disease outbreak significantly. Clean water reduces disease outbreak significantly.
State registries and other
instead of sticking needles in arms, how about we just make sure people have clean water and shelter and aren't living in their own feces? That's how you stop disease.
Whether that's other vaccines,
stop dropping bombs and destroying infrastructures. That's how you stop disease. You don't hear any of these heroes talk about stopping the wars. You don't hear any of them talk about that. That's what's spreading disease. Also, experimental vaccinations that spread disease. And a lot of them, a lot of these vaccinations are being used in like India and Africa, and that's spreading disease as well. Vaccinations can spread disease. People need to know that too.
That proverbial wall of disbelief, we've now learned that it's possible and useful. I believe consumer access to their health information has been a policy priority for many administrations, bipartisan in the U.S., globally. And we've also, in many ways, seen in the demand signal here a sense that there's a wall of disbelief that consumers simply don't want access to this or wouldn't want to share it. We're actually living through the reality that this is the model, and hopefully we can build on the kind of consumer experience that works and see this
consumer
carry
experience,
forward
yep.
into the day-to-day decision making so that everyone
We're consumers.
can get the best
We didn't ask for this shit, but we're consumers. I mean, whoa! If you want access, you have to be a consumer.
Technically and from a policy perspective to support that demand signal.
Thank you, Anish. John, maybe I can come back to you for a minute. We obviously at the VCS steering committee have been thinking. We've been heads down, getting a standard created, getting kind of it stood up for COVID, vaccine, COVID-19 vaccines, COVID-19 diagnostics.
Are you okay?
But can you talk a little bit about
consumer experience? Yeah,
about some of those
like
next use cases.
did these people who downloaded these apps know that they were going to be lifelong consumers, or did they just download the app because they were told to because they couldn't fucking do anything like work or go to a restaurant? They didn't know they were a lifelong consumer when they downloaded this thing. That's the thing. There's no informed consent with vaccination, and there's no informed consent with digital identity. None.
We need to be able to have better liquidity of data, better patience.
They're going over, man. But they started late because of technical difficulties.
But here's the challenge.
Allegedly.
You got a trust issue. Now, imagine this, Paul. If I came to you and said,
Trust.
I'm going to tell you my family
Here we
history.
go. The
it's
old
on my
trust.
phone, it's fine. My bet is you'd say, family history.
Hi.
Why would you have any motivation to
Hi, Matt.
that anyway?
From the West Coast.
Did I tell you I need my OxyContin prescription replaced? It's on my phone. I mean, you can trust it. I take 30 every hour, right? I think you would agree that may not be a trusted bit of data.
Oh, OxyContin. Yep. Maybe keep the opioids out of it for now. That might be a good idea. Because then we'll remind people that Big Pharma's fucking horrible.
And the whole notion of a smart health card, whether it's lab tests, whether it's vaccinations, whether it's medications,
test medications, vaccinations. Yep. Let's put it all on there. Let's do pap smears, anal exams. Let's put it all on there. Let's just put it all on there. Anytime they stick something in your throat or up your nose or in your butthole or in your PP or your VB, let's just put it on there. You can easily send it to other applications. You can easily flash it, and you'll have trusted access, guys. Trusted fucking access.
Well, I think John was just incredibly eloquent about, and we all know there's a
they sure did start late. Technical difficulties.
And so anytime a person
I just imagine people were late because Microsoft's one of the backers of this. I really doubt they had technical
so immediately
difficulties.
That makes you think of education beyond health. And
PPVV.
skilling, in particular, credentialing, with our Trailhead products, for example.
It's going to be on your app,
but it really
your
cuts
PP or your
across every
VB.
industry that increasingly this is going to be a great way for people to safely prove who they are without revealing
one into the
all
other.
The information that they
Interoperability. End-to-end.
You don't need to know
Turnkey.
the driver's license, my birth date, but you need to get the thumbs up that I'm old enough to go to an event, for example. All right.
Wait, are we comparing this shit to being 21 or 18? This is crazy.
No age restrictions for me, but I think this is a broad applicability across every industry, every sector.
Salesforce approves.
Across the globe.
Yep.
Really.
Salesforce. Yep.
Great. Well,
thank you so much, Salesforce.
Maybe we'll wrap up in just a minute. We're running over. I go all day with this amazing group of people.
I mean, I could go all day.
Anisha, I want to come back to you for maybe some closing parting thoughts.
Giving commentary to this hellscape that they're rolling out.
Healthcare industry to adopt standards. Any kind of final words or calls to action?
Just a reminder, the Commons project that you see in the bottom right here is a startup that just happened to pop up before COVID, and they just happened to be like the startup that latched on to the vaccine passport and got major contracts with these huge corporations. Not planned at all. It's just a little startup, and they just stumbled into the vaccine passport game. Totally unplanned.
This consensus building effort to standardize content and distribution methods of sensitive health information.
There might be a delay because I'm on my shitty laptop and I'm sharing a Zoom call, which is already choppy on my YouTube.
Rinse, repeat. Let's go down the list.
So it's probably very choppy.
John gave us extremely
Sorry.
helpful, practical,
In the
ghetto. Health information that's trusted. That can be incorporated into decision making.
A lot of trust.
This is a case study, and I'm very proud of it.
I think if we say trust, about 200 times in one global forum, we can definitely gain trust. I think that's it. I think we got it, guys. I think we got your trust. I think we grabbed it today. Trust. Do you trust us? Because we said trust, so you must trust us.
Well, look, thank you.
I mean, come on. Meredith is a lizard person. I mean, nothing is even shocking anymore. Nothing is shocking. She probably is a fucking lizard.
Is the website where everything about.
Oh, we're gonna go check out vci.org. Stay tuned. Don't go anywhere. We're gonna end this stream with a little vci.org. Oh, yes, it is. Can't wait to show you who's behind that initiative. Ooh, boy.
Please join VCI and become part of this pretty extraordinary community. Information about the Common Trust Network available at commontrustnetwork.org. I again want to close by just saying thanks for all of our amazing panelists.
Thank you so much, Common Trust Project, or whatever the hell you're called. Thank you for just appearing right before COVID and then taking the lead on this. Because it would look really bad if Microsoft was the leader of this, or Johns Hopkins was the leader of this, or the MITRE Corporation was the leader of this, even though they're all attached to it. It would look really bad if any of them led the way. So they had to get this startup that no one knows. They had to get this startup that absolutely no one knows. Because it's, we're building trust. We're building trust, guys. Like, what the fuck did I just watch? Apple, if you didn't see it earlier, Apple was like, yeah, you can just, the smart health cards is, it's interoperable. It, connects to your digital wallet. Literally said it. Literally said we're connecting your vaccinations and your money. It's there. It was in it. I mean, they don't explicitly say that. They don't get into the nitty gritty, the dirty, and then they didn't explain how this is actually going to stop COVID or anything in the future. There was no real public health talk. It's all about the technology and granting access and building trust and building community and bringing people back together, but not actually stopping any disease, not actually stopping any virus. This is crazy. This is actually cuckoo bananas. And if you're buying into the Smart Health Cards initiative, which is going to be global, because this is a global forum that we just watched, you are a sucker. All right, so let's go check out. Oh, another share screen. This has been a lot of work. Damn it. Let's find. Where is that? Oh, I think it closed. Oh, there it is. Here is what I'm looking for. We're going to share vci.org. That's what I want. Bingo. All right, so let's go over to that. So here we are, vci.org. We just saw the global forum. We just watched that. It was a 2-hour global forum. They got their little hashtag that no one's going to use. They just did that to make it look like, they're professional and whatnot. But let's look who's involved. Oh my gosh, this is on the main page, all right? So this is vaccinationcredential.org, VCI. And we have Amazon Web Services. We have both the California and New York state governments. They were the state governments that were passing tyrannical medical legislation before COVID. So there's some clues there that they were preparing for what we're going through right now. New York State, where I live, in 2019, they were trying to pass laws that allow schools to vaccinate children without their parents' consent, which is fucking absurd. That actually happened in the Bronx, and they killed a kid. So they covered that one up pretty good, although there are news stories about it. That's crazy. And they were also at least in one county of New York, trying to pass mandatory adult vaccinations, but that never really came to fruition, and we don't know why that was happening. I think they were just trying to normalize the idea of mandatory adult vaccinations for what we don't really know, and they didn't really explain that when they had a little press conference about it. It was all about public health and all that. Cerner, which we saw today, the Commons Project, is a little startup that they're putting kind of in the front. It's like the front man of this whole initiative because they don't have a horrible history. So it's like, oh my God, we're building trust with the Commons Project. We have Microsoft. Obviously, we know Bill Gates is no longer part of the board, but definitely still has power there. The MITRE Corporation is a defense contractor. They work with the Army. Mayo Clinic, I have issues there, but what else we have? Salesforce. We saw Salesforce. Oracle. I mean, these are horrible, but like that's only the tip of the iceberg. They make it look like it's just a handful of companies, but if you click on about participating organizations here, there's a lot more. And the governance. Look, check out the governance. Look at all these members. Holy shit. That was fast, huh? Because, to go back to normal, we need to have all of these people on board. Like Advent Health. Like Google. Oh my goodness. Apple. There it is. Safe health, safe identity. Oh my God, we're so safe if we all come together and build community. I mean, this is. I haven't even heard of half these companies. Boston Children's Hospital, State of California, State of New York. Yep, there are a lot. IOTA Foundation. I want to say that was started by Charles Hoskins of Cardano. I could be wrong. I might be getting that name wrong. Maybe that's a different foundation. Mayo Clinic. This is just incredible. It just goes on and on. UC Health, the MITRE Corporation, some universities like Alabama at Birmingham, UC Davis, University of Chicago Medicine. Shout out to Allie. University of North Carolina, UNC. VaxPass. Look at this creepy shit. VaxPass. Oh my God. Oh, Duke University Health System. I mean, they got everyone. Everyone signed up. Walmart. There's Walmart. Optum. Epic. They're all here. ZocDoc. Holy shit. So, I mean, that's an incredible lineup. And we're not done. Because we also have people who issue the smart health cards. Now, here are the states that are already on board. They said 6. They said 5, and then the 6th one has silently jumped on. Well, we actually have 7. They were wrong in their own global forum, which is hilarious. We've definitely started it in New York here. Jersey started using it, although the mandates are not as strict in New Jersey. California, obviously, all into that medical tyranny. Hawaii, because, tourism, they're pretending like this is going to help people when it's really just going to help their local economy. Louisiana, very interesting. That one's there. Utah and Virginia. Virginia being right outside of DC. That's actually not a surprise. And Utah, that's very weird to me. I feel like there's probably a lot of pushback in the state of Utah. I'm surprised Colorado's not on this. Colorado's been very weird with their rules and their mandates and whatnot. I do expect Colorado to pop up very soon on this list. And then here's all the organizations around the entire world, or at least around the country, that are issuing these cards. I imagine some of these are in Canada and other places, but holy crap. Atrium Health, San Antonio Regional, like Johns Hopkins, Kaiser Permanente, Beth Israel, which is big here in New York. I mean, this is crazy. But we got to get back to normal, so we all got to jump on board. No one's questioning this? Okay, cool. Mayo Clinic. What were we looking for in... there it is, Mass General Brigham. You were right, Sassy. They done jumped on board. There she is. Not even a surprise, is it? This is crazy. Cleveland Clinic. Yukon Health. Mount Sinai, Florida. I don't know about Mount Sinai, New York. There's a huge chain of them here. United Health Services. Of course, we have some insurance companies in here sprinkled throughout. The list just goes on and on and on. Penn Medicine, Walgreens, there they are, issuing it, of course. Rite-Aid's in here somewhere, I believe. Where's Rite-Aid? At the top, I believe. Top right. Yeah, there they are. So, yeah. I mean, if you don't consent to being a consumer, well, you just won't have access. Like, your life. You are the product, basically, now. It's basically like your body is being turned into a utility. It's very strange. Everything that's happening is very weird. And no one really wants to talk about this anymore. It's very, very strange, except for the, people like us. But you don't see anyone stepping up, Mass media is completely controlled. I wonder what people that work for some of these companies are thinking. We're not seeing anyone risking their job, really. I haven't seen it, at least. If you see any stories like that, let me know, where people are fighting back with what their companies are doing as part of this global initiative, which they're acting like it's not. Biden keeps saying, we're not going to do this universal thing. We're not going to make universal mandates. And it's coming. It's inevitable. And that's part of the plan. It's been part of the plan. And they're lying to you. That's the crazy part about all this. They're fucking lying to you. AWS is Amazon Web Services, I believe. It's a part of Amazon. I think it probably incorporates the cloud, which is like half their business. Half their business is the supply chain, and half their business is the cloud, which they won. They didn't initially win the contract, but in 2019, the Pentagon gave like a $10 billion contract to Microsoft, and then Amazon sued because they said it was unfair or something like that. And they're like, well, the only reason why we didn't get the contract is because Donald Trump hates Jeff Bezos. But also they probably didn't get the contract because Bill Gates was setting up this COVID shit. And of course they're going to give it to Bill Gates. And Bill Gates has a lot of R&D in Israel. So of course they're giving Israel the back door to the Pentagon by giving the contract to Microsoft. And then Amazon had to go in there and be like, oh, well, we want the contract. We were, not treated fairly. So they re-examined that. There was a lawsuit. And then they canceled Microsoft's contract, and now the Pentagon's cloud project, or all the data, all the data storage for the Pentagon, that contract has been awarded to both Microsoft and Amazon, some kind of joint collaboration, because we need to just consolidate power and make sure the same, these couple of corporations have as much access and power. It's just crazy. We're just making sure Microsoft and Amazon are here forever, here to stay. It's nuts. So Amazon Web Services, yeah, a lot of people don't realize that Amazon is they have two major business models, and that's the supply chain and the web services, mainly the cloud storage, which they're like kind of number one at. Actually, low key, Amazon is a leader in data storage. When is Alexandra going to get back on Ricky Rice Mystery Science Theater? We could do a little more Mystery Science Theater. I'm down. Whoever wants to jump on. If anyone wants to join a stream, and we can shoot the shit while we look at creepy shit that's happening in the future, I'm down. There is one thing I want to explore. It's been online for a long time, but I haven't really explored it. I want someone who knows London really well. If you know someone who knows London really well, I'd love to have them. I wonder if Chatham House had a futuristic London. It was like a walkthrough 360 digital journey of the future of London, where they turned it into a smart city. And it's so creepy. I clicked on it for a little while, but I don't know London well enough. I'd really love to talk to someone from London and have them bring me on a tour of the future of London and comment on how creepy it is, because I think they would find it very creepy. Some people might like it. I don't know. Amazon Web Services. Yes, it is. Are there any correctional companies listed? You mean like private prisons? They probably wouldn't list those, at least at this time. Do you mean what do you mean by correctional companies? Loony bins? Mental hospitals? What do you mean? If they're risking their jobs, they won't put it on the big news. Yeah, these people really care about their jobs. I would probably not, but they probably wouldn't hire me to begin with. So there's that. All right. Well, I think that concludes everything I wanted to talk about. That Global Health Forum was crazy. They had a Global Health Forum where they didn't talk about health. They just talked about vaccine passports and granting access and building trust and building community and having interoperability. That's nuts to me, though. You can literally have a 2-hour forum about healthcare and not talk about healthcare. And people are buying into that. That is what is nuts. That is what is absolutely crazy to me. All right. Well, thank you for joining me today. That's one way to start my day. That is absolutely crazy. Yeah, if you see any crazy pertinent info, send it my way. Or if there's anything you want to do a Mystery Science Theater 3000 style panel on, just let me know. We'll do a little live stream and look at creepy shit. Although it is choppy, though. You see when I share video through a live stream, it does get choppy. So I don't have the resources to do something that's super sharp, but it's fun. We try. All right. Enjoy your day, everyone. Thank you for stopping by. And say no to vaccine passports because it's creepy.